All right, let's break down a really unique hearing condition called otosclerosis. So here's a weird one. Have you ever heard of someone hearing better in a loud room? You see, the main symptom is a slow hearing loss, usually starting with low-pitched sounds. It happens because in noisy places, everyone just talks louder, right? It cuts through the hearing loss.
So what's really going on here? Well, it all comes down to otosclerosis.
Basically, spongy bone starts growing where dense bone should be, right in your middle ear. Think of it like a rusty door hinge. That tiny Stapes bone gets stuck and can't vibrate. The exact cause? It's a bit of a mystery, but we do have some strong clues. For starters, genetics are a huge factor. It really does seem to run in families. And it's way more common in women, often flaring up during big hormonal changes. Okay, so how do doctors actually figure this out? It's a mix of exams and tests. What's wild is that the ear usually looks totally normal.
That's a big hint right there.
Next up, they use some pretty simple tuning fork tests to gather more clues. And boom, these results point directly to conductive hearing loss. The sound just isn't getting through. But the real gold standard for diagnosis, that's going to be pure tone audiometry. And the key finding they look for is a dip in hearing right around 2000 hertz. Now for the really good news. There are clear pathways to getting your hearing back. For many, hearing aids are a great first step. They just turn up the volume, you know? But for a more permanent solution, surgery can actually bypass that stuck little bone. Stapetotomy is more common now, but both surgeries create a new path for sound. And the results are huge. Surgery dramatically improves hearing by closing what's called the air-bone gap. But after the surgery, recovery is absolutely key to making sure it all works. The main thing is to avoid anything that creates pressure in your head, so no sneezing. So yeah, we've gone from a strange symptom to some really amazing effective solutions. It just shows you the incredible precision of modern medicine. Makes you wonder, what's next?